I think I'm having issues with my video. I'm not sure what's on. I can't see myself. Anyways,
We can't see you either.
all right. So I'll be sharing my screen in a minute. So come in, please. All right. Can you see my screen now?
Yes, we can see your screen.
Okay. All right. Let me just go to the topic for today. So today's topic is causes and prevention of halitosis. And if you check the message that was sent, the broadcast message, it talked about what halitosis means. And so halitosis just means bad breath. And so we'll be talking about what causes this bad breath and how can we prevent bad breath from occurring, or even if it has already occurred, how can we get rid of it? And so, as a way of introduction, halitosis is the medical term for bad breath. It describes an unpleasant odor in the breath, and then this unpleasant odor can be detected by other people when you speak or when you breathe. I'm sure many of us worry about having bad breath at some points in our lives. It might not be the very serious bad breath, but it can just be maybe when you wake up in the morning, you don't really want to talk to people because you've not freshened up yet and you don't want to appear as having bad breath. And so while having bad breath is not dangerous in itself, it can be embarrassing because we tend to get more comfortable with our own odor. And oftentimes people who eventually have this bad breath do not know that they actually have bad breath. And so that is why we are talking about it today, and so that we can know how we can get rid of it or prevent ourselves from even getting to that stage. And so as a way of statistic, the exact number of people with bad breath is unknown. However, studies have shown that as many as half of the population can sometimes have trouble, can sometimes have problems with their breath. So I'm still trying to work on my video, but it's not coming on. So I will just continue in the meantime. My sincere apologies. So what causes this bad breath? The mouth is home to hundreds of bacteria, and then these bacteria digest protein. And as the bacteria digest this protein, several unpleasant odors can occur. And so we'll be talking about different causes of bad breath in subsequent slides. So kindly pay attention as we go along. And so bad breath can come from different sources. It can come from the mouth, it can come from the nose, and it can be a combination of the two. And so one very common cause of bad breath is crash dieting / fasting or protein-only diets. I know that some of us here might be in the season of fasting. And so that is why this is also important, so that you can bear in mind measures that you can take to prevent bad breath from occurring. And so why this happens is because after a few hours of dieting or fasting, the body breaks down its fat stores. And because we're not eating, the body tries to get energy from other sources in the body. And one of these sources is the fat. And then once the body breaks down fat, a chemical called ketone is released. And then what happens is that this ketone is breathed out with each breath. So low carbohydrate diet can also cause this kind of bad breath. And then the kind of breath you have is this distinct, sweet, and sickly smelly breath. And this is also really common in people who have diabetes. And so there's this emergency where there's something known as DKA, usually in uncontrolled diabetes. You also notice that their breath is kind of sickly and smelly, and it's also because of this ketone. And even people who are undergoing starvation, that's people with certain psychological issues that prevent them from eating, they also can tend to have bad breath caused by this chemical called ketone. And one other common cause of bad breath is what's known as the bad morning saliva. So this is common. So you usually just say it is physiological. When we wake up in the morning, you notice that there's this odor coming out from the mouth. And the reason why is that we all know saliva, that's the watery substance that come out from the mouth. It plays a big role in eliminating bad breath. And when we are asleep, the flow of saliva is reduced, and then the tongues and the cheeks don't move much. And so because the tongues and the cheeks are not moving, dead cells that normally shed from the surface of the tongues and the gum and from inside the cheeks begin to accumulate. And because the saliva is not there to move these residues away, bacteria start to work on them and then digest them. And over time, we get to have this unpleasant smell that is coming from the mouth. And so these are the very, very common causes of bad breath. And so one other cause is when the mouth is dry. And then the mouth can be dry for various reasons. And one of them is during sleep. Like I said earlier, during sleep, saliva production is reduced. And one other reason why the mouth also can't be dry is when we don't take enough water. And so when we don't take enough water, the saliva production rather is reduced. Dry mouth can also occur as a side effect of certain medication. And I kept like a group of medication, and some of them are like sleeping tablets. And so sleeping tablets can have certain side effects that cause dry mouth, and then dry mouth can then cause bad breath over time. And so if there are certain mouth infections, and so dental just means the mouth, so abscess just means pus collection. So if there's any pus collection anywhere around the mouth, it can cause it can cause bad breath originating from the mouth. And then the other cause is altered blood. So altered blood just means stale blood around the gum. And so if you look at the teeth, just above the teeth, there's what we have, the gum. And so altered blood around the gum, either together with pus, usually when the gums get inflamed, you see that the gums are red and painful. That's what we call gingivitis. And so together with this altered blood, they can cause bad breath. And so aside all these different options that we've talked about, it can also be bad breath, that is the mouth odor, medically known as halitosis, can also be caused by germs. And how do these germs arise? Sometimes food gets stuck in between the teeth. And you know how during parties or even our normal breakfast or lunch, sometimes you're eating that very hard meat and you're trying to tear the meat, and then it just gets stuck in between the teeth. And when you brush the teeth, and what you notice is that with normal teeth brushing, you might not be able to clear the food that's stuck in between the teeth. And over time, this food that gets stuck in between the teeth can then rot, and then germs then begin to accumulate on it. And so that's one way where bad breath can be caused by germs. The other way bad breath causes germs is through the tongue, and I'll be explaining that shortly. And so what you will notice is that there's something we refer to as coating, and this coating can occur at the back of the tongue. And so individuals, their tongues are deeply grooved and they have more potential of accumulating this coating than others with a smoother tongue surface. So this coating deprives the area of oxygen, and then the bacteria that causes bad breath, it flourishes in the area where there is no oxygen. And so first things first, the tongue is deeply grooved, and then there is now more bacteria, and then this bacteria is now blocking off oxygen supply, and then this bacteria can now flourish in places where there is no oxygen. And so that is one other way bad breath arises. And so there's so many other ways how bad breath can occur. And so if you are just joining, I'll just give like a brief recap. So far, we talked about what bad breath means, that's halitosis, and how that it is usually detected by other people when you speak or breathe. And we've talked about the various ways bad breath can occur. We talked about how it can be due to dry mouth. It can also be due to early morning bad breath. It can be due to fasting or keto diets or taking only protein diets or reduced carbohydrate diets. And now we're talking about how bad breath can also be caused by germs. And then these germs can arise from food stuck in between the teeth or from tongues that are not properly cleaned. And then now we're talking about dentures. I don't know if you've watched those movies and usually more common in elderlies. And so because most of their tooth is missing, they then get artificial teeth. And so they are usually referred to as dentures. And usually the dentures are not meant to be worn overnight because these dentures intensify development of halitosis, and they also make oral hygiene process difficult. And so coupled with the fact that you might not be able to brush your teeth easily with these dentures, if you now leave them overnight where the saliva production is reduced, everything just intensifies the development of bad breath. And so the other will be plaque and gum disease. And so plaque is like a soft whitish deposit that forms on the surface of the teeth, and it combines. And when bacteria combines with this plaque, together with food and saliva, it can cause bad breath. The other cause would be tonsil stones. And so for those of us who have children, sometimes you will notice that when you complain of sore throat and then you look into their mouth, you see this very red and big shiny object in the two sides of the throat. So that is what we just usually refer to as tonsils. And sometimes there might be clusters of calcified materials that form around these tonsils, and they are usually made up of calcium, and they sometimes feel like a lump in the throat. And so remember I said that bad breath can come from the mouth. So we've talked about bad breath originating from the mouth in this slide, where I talk about dry mouth infection, and altered gum. We've talked about from germs, and now we'll be talking about bad breath coming from the nose and from the throat. And so sometimes, especially in children, foreign bodies, also foreign body can be something as simple as seed, all these minor buttons. Children can be very playful, and then they just inhale this thing in their nose, and that might just be the origin of this bad breath. Or they can even be throat infections, and an example of these throat infections is what we call tonsillitis or sinus infection. So sinuses are like pathways in the brain, in the nose, in the cheek. So sometimes these sinuses can get infected, and then bad breath occurs. And so the origin of bad breath can also be from the stomach and the gut. And so gut just simply refers to the intestine. And so just to be sure that you are following me so far, if you can just type on the comment section the various avenues of that bad breath arises, so I can be sure you are following me so far. I should have mentioned about 5 or 6 so far. So I'll just be checking just to be sure that we are all following what causes bad breath. And so I'll just continue with bad breath coming from the stomach and the gut. So one is what we call acid reflux. And so acid reflux, if you've heard of people complaining of a pepperish sensation in their abdomen, and so it can be classified as what we call GERD, that is GERD. And so it just means that the chemicals, that's the the acid produced in the stomach is then is reflecting back to the esophagus and then to the upper, that's to the throat. And so that's what we call acid reflux. And so because this acid is stale, it can also cause bad breath. Okay, thank you so much. Joshua says sinus infection, tonsillitis, and plaque. That's correct. Faye says keto diet, deposit on tongue, sore throat. That's also correct. Okay, so medications, fasting. Thank you, Genia. All right, so I'll just go along. So acid reflux can also be a cause of bad breath. And then this second one, Helicobacter pylori. And so for short, you can just call it H. pylori. And so people with ulcer, that's peptic ulcer, that is also affecting the stomach or the duodenum, which is a part of the intestine. What has been seen is that there's a bug, a bacteria that causes this ulcer. And what research has shown is that up to 87% of patients with bad breath actually have this infection. And this infection can be tested via blood or via stool sample, and it's easily treatable. And so for people that have ulcer, this bug, H. pylori, may also be present. And then 87% of people with bad breath have actually been found to have this H. pylori infection. It is easily treated via medication. And so there are also other medical conditions that cause bad breath. It can be something as simple as chest infection. And so by chest infection, so some of the symptoms can range from cough, catarrh, fever, and some other common examples that we might know of chest infections can be pneumonia, or if there's a lung collapse. The other one is diabetes, and so that's high blood sugar. So poorly controlled diabetes can also cause bad breath. Kidney disease, liver disease, these are systemic conditions. That means conditions affecting the whole body, and then one of the signs can just be bad breath. And so there's a very rare disease, fish odor syndrome, which I kept here. And so in this disease, there's a chemical called trimethylamine, which is in excess. And then what has been noticed is that the individual odor is similar to that of the rotten fish. And so this is like a rare disease, but it's also a cause of bad breath. And then the other cause that we'll be looking at is a psychological cause. You know how in psychology there are different conditions, and there's something known as delusions. And so in delusions, people think that they have something. And so for some people, it might just be that they feel like they just know that they think that they are the president of the country. And so they can be talking to you like, I need to go to see the governor, I need to do this, I need to do that. For some people, it might be delusion of reference. They would say that, no, they are kings, they are queens. And for some other people, it can actually be that they falsely believe that they have bad breath. Meanwhile, you are just beside them, you cannot perceive any odor, but they strongly believe that they have bad breath. And for this category of people, of course, you will need to exclude every other causes I've talked about. And so they've done all the checkup that there is to be. And even as at that, the dentist still cannot even perceive any bad breath arising from this patient. And so in these categories of people, they might need to see a psychologist to also help with the bad breath. And so we'll be going into how can we get rid of bad breath, or how can we prevent it in a short while. And so these are also other causes. Smoking cigarettes. You know, it's very easy to tell people that smoke when they come close to you because their breath smells like an ashtray. And the only way of curing this type of bad breath is actually by smoking. And so one thing that cigarette smoking does is that it also increases your risk of developing gum disease. And if you remember where I talked about gingivitis, so gingivitis is an infection of the gum. So cigarette smoking also increases your risk of developing that infection of the gum. And this combined together can also cause bad breath. And so taking alcohol, especially in excess, is also a cause of bad breath. And then the next line I have here is artificially induced, meaning it's from external sources. And so there are some meals that are known to just give a particular breath. and one of them is garlic. I'm sure some of us here enjoy using garlic in our meals, especially fried rice and the rest. And so this breath is transient. It is peculiar to garlic. Once you've drank water and you are not taking the garlic, you are okay. And so onions, we all know how onions smells like. And so this is also an example of artificially induced breath. And so there are also some common medications that have been known to cause bad breath. And some of them are what I've listed here. And so how do you know that you have bad breath? And so the reason why we're talking about bad breath is that usually the person affected tend not to notice. And because, like I said, we become used to our own smell and we do not notice when your breath is bad. And often the only way you know is if someone comments on it. And usually because people are too polite to comment on your breath, you may have to rely on maybe a close friend or a family member who is honest enough to tell you that there's something wrong with your breath. Right? For some people, it can just be in hidden clothes, like the Valentine that just passed. If you notice that you are getting more of mint, sweet, it might just be a time for self-reflection, just to be sure that there's nothing wrong with your breath. But one simple way of checking or detecting bad breath is what you can do is to lick the inside of your wrist. And so once you lick the inside of your wrist, you just wait a few seconds for the saliva to dry. Then you smell that licked part of the wrist. And if you detect an unpleasant smell, you are likely to have bad breath. And so another way of knowing if your breath is bad, because like I said, it's a subjective diagnosis, meaning it relies on individual to say that there's something wrong with your breath. And so there's a specialty of medicine known as dentistry. And so the dentist is a doctor that deals with oral health in general. And so once you visit a dentist, they'll be able to say if your breath is fine or not. And then based on the origin, like I said, if it's coming from the mouth, it's most likely just limited to the mouth. If the bad breath is coming from the nose, then we'll think about all the other causes we've talked about that originate from the nose or from the sinuses. But if it can be perceived from both the nose and the mouth, then you'll be looking at more systemic causes like liver disease, kidney disease, and the likes. And so there is no specific consensus regarding the duration of bad breath. So we cannot say because your breath has been bad for 2 weeks, you have been diagnosed with halitosis. So there's no general duration. However, like I said, the standard test just involves smelling the breath on at least 2 to 3 different days. And because gum disease is a common cause of bad breath, once you visit a dentist, you'll be advised, and then if you are noticed to have gum disease, it will be treated accordingly. And so remember I said it can also be systemic, meaning that the origin might not just be from the mouth, but be from other part of the body. And so doing a physical examination or having tests done, remember I talked about H. pylori infection, may also be required in cases like this. And so how do you prevent / get rid of bad breath? And I'll be talking about 10 to 11 simple ways. And the first one will be use of antibacterial mouthwash. And so you want to consider using a mouthwash each day. And what this mouthwash does is that the chemicals kill this bacteria and they neutralize any chemical that causes this bad breath. And so this mouthwash contains various ingredients that are good at reducing bad breath. And some of these include chlorhexidine and other chemicals I've listed here. And so usually most mouthwash just usually contain one or more of these ingredients that will be very helpful. But it's very important to note that using mouthwashes tend to have an unpleasant taste. and can also cause a burning sensation if used too frequently. So you do not want to use mouthwash for a very long time. And it can also cause staining of the teeth or temporarily darkening of the tongue. However, this is easily reversible. What you just need to do is to brush your teeth first before making use of this mouthwash, and then this side effects will be greatly reduced. And one other thing to note is that some mouthwashes contain alcohol. So you want to be careful in giving it to children because sometimes they may swallow these mouthwashes. And so the second way of preventing and getting rid of bad breath is by brushing your teeth and gum line at least twice a day. And so that's the recommended guideline. And then the toothpaste should contain fluoride. So most of the toothpaste present in Nigeria actually contain fluoride. And so what the guideline says is that you want to brush in the night and then one other occasion. And then the duration for brushing should be at least 2 minutes. It's not that you just grab the brush and then you just go in a very horizontal way, then vertical way, and then you spit out. No, it should be for at least 2 minutes. And you want to pay attention to every area. So you're looking at the inside, the outside, and then the part that you use in biting. So you also want to pay attention to where the teeth meet the gum while you are brushing your teeth. And so the toothbrush, you can be a manual toothbrush or an electric toothbrush, depending on the one you have access to. However, you should make sure that the brush is soft tufted and should be of a medium texture. And so remember I talked about using toothpaste that have fluoride. And so fluoride is very helpful in oral health. And so you should not spit out after brushing. I mean spit out after brushing, but you don't need to rinse it with water again, because once you finish brushing and then you now rinse whatever is left with water, the fluoride content greatly reduces. And so it's just like, what's the point of using the fluoride containing toothpaste if you're still going to rinse it off? And so once you finish brushing it, you as well just spit it out. And this last line is something that we are all sorry. Please mute mic. I'm just I'm not sure if the host can help us to mute this music, please.
Okay, manos en el aire todo el mundo. Esto es Tú no lo sabes, te estoy vigilando. Desde la distancia me estoy acercando. Soy una sombra y tú no te das cuenta. Hola, ¿qué tal? Date la vuelta. Llegó la hora de volar. Acércate a mí porque vas a explotar. ¿Qué me vas a hacer? ¿Qué me vas a morder? Todo el mundo que me ve solo sabe correr. Vacas, caballos, pollos y ovejas. Quiero tu cabeza en bandeja. Mira cómo tu cuerpo se aleja. Se han acabado las quejas. La batalla ya empezó en un mundo muy cuadrado. Sangre derramo. Dentro del mundo de Minecraft sí que puedo. La batalla ya ha empezado en un mundo muy cuadrado. Esa línea de fuego donde sangre derramo. Mírame de frente y no me escondo. Te disparará la muerte. Dentro del mundo de Minecraft sí que puedo.
Argentino XD, jugar todo el tiempo gameplay, XD, soy el gamer argentino, bien argentino, oye,
Guess what?
yeah, gameplay, XD.